Hi, Paul Coker here from onebloodydrop.com. I'm really excited today. I'm here at the Bristol Royal Infirmary and I'm talking to Dr. Rob Andrews. Dr. Andrews is a diabetologist running a clinic which specialises in diabetes and exercise. He has a number of patients who are elite athletes and even Olympians, and he has a special interest in diabetes and exercise. So in addition to your clinical practice, I know that you lead a team who are involved in research in diabetes and exercise to support the clinical evidence, the clinical advice that you're giving. And in our previous videos, Dr. Andrews, you've given some incredible advice about aerobic exercise, anaerobic exercise, high intensity interval training. And in this video, we're going to be talking about mixed mode sports. What that really means is things like football and rugby and netball and what else might it mean?
Yeah, so I think this is really the most important thing, and actually from us of giving out advice, we've really lagged behind. So we've tended to be very scientific about it and say what happens when you do anaerobic and what happens when you do aerobic. And the average person does a mixture of the two together, so mixed sports. So what you're talking about is events where there can be a bit of sprinting, a bit of all out, oh I want this, and a bit of just jogging around or following the ball, and it tends to be team sports that happens in, but it can happen in other sports. So it can happen when you're playing tennis. There can be long rallies and then short rallies, so that's an anaerobic and then an aerobic event thing. And it's the real light bulb moment for the patients when you explain to them actually what they're doing isn't aerobic, and that's the reason why the blood sugar isn't going down. And the easy way of thinking about it is how often is the ball in play. So most people come to us and say, I play rugby and it's an aerobic event. And then you say to them, but actually, even is that the team that keeps the ball in play the longest is the All Blacks, and they do it for twice as long as any other team. And the longest the ball's ever in play for is 1 minute 40 seconds. So it's a short event that actually is periods of doing something, periods of not doing something, periods of doing little levels. So what that can mean is that the blood sugar can go either way depending on what's happening, and that's really difficult for people. If you're playing a team that is really that's much better than you, you're spending lots of time defending. So actually you can be doing aerobic for a very long time. If you're playing against a team that you're much better than them, then actually you're not having to put much effort in, and people find that really difficult to manage their glucose. So you have to be able to adapt and do that, and that's where at least these events have half times, and with the American events they have quarters, so you have a chance to have a look at the blood sugar and just make adaptations as to what's going. So
that's really interesting. I'd never ever thought about the ball being only in play for 1 minute and 40 seconds. That's an absolute revelation. I've watched rugby matches for the last 10 years and never ever noticed that. So in terms of managing your diabetes, what should you do before you play a mixed mode sport?
So I think what you've got to do, this is where as we said before, is records are king. So it's knowing what happens with those events, and you also have to. The other problem that sometimes we don't talk about with these individuals is that in the UK we have a very strange way of organising our team events. Is that we expect people to train in the evening in the weeks, but they play their matches either mid-morning or mid-afternoon. So they're having to learn to adapt for the actual thing that they're training for with different regimes. And what that generally means is that in order to do that, we have to look at their background. So most people who are playing team events, we have to look at, would it be better if you're on twice daily background, because that gives us the flexibility of changing in the evening if they've changed in the evening, and changing their background in the morning if they're going to play in the morning, so they haven't got as much insulin around when they're playing. So that's the first thing we have to look at, is the type of insulin they're on, and if you're on a pump, is the profile. So for the pump profile, we don't generally try and get a match day profile that's different from the week training profile. So that's the first thing, is to look at what those profiles are. The other thing which we haven't talked about before is how important the diet is in these situations. So team people or people doing endurance events are doing lots and lots of training, and most people with diabetes have been told actually sugars are bad, but as your training goes up, you need to have more carbohydrates, and it goes up really quite substantially. And the commonest reason that we see in clinic as to why people are struggling with low blood sugars and their blood sugars are they're just not taking enough carbohydrates day on day in total quantities. So those are the two main things that we would look at even before we start thinking about what's the plan for everything else. And then it's a question of what does the blood sugar do? On the whole, you will have to reduce the insulin if you're in the window of doing a team sport, because it tends to go on for 90 minutes and you will get some insulin sensitizing. And if you're outside of the window, then you might have to think of changing your background. So it's a tiny bit more complex. But what you might find is that depending on how anxious it is and what's going on in the game, is that at halftime you might have to take a small amount of insulin because actually the blood sugar initially kind of fell but then has gone up with the stress of the game. So there just has to be some adaptation as to what's happening.
And I'm guessing in the same way that we spoke about on aerobic exercise, where I can go and train and I have one profile for training, and then I get to a start line of a half marathon and my I get excited and hormones start flowing around, and I get stressed and my blood glucose level goes up. I guess you may see the same if you're playing in a league for, say, football or rugby or netball, and then you get to a day where it's a cup final match, that you might actually experience something different then.
Exactly. So what we try and do with teams, we try and encourage people to do with team sports, is just have a bit more insulin around and adapt by having the glucose, because it's much harder in the match to manage the blood sugars that go up than to manage the blood sugars that go down, if that makes sense. So we much prefer them to have a slightly higher insulin level that they have to be eating regularly, and then just clamp them at that. And then if they find that they're doing a bit more, then they can have a bit more carbohydrate. If they find the blood sugars are going up, then they just cut back on the carbohydrate and it will fall because they've got the insulin around. Does that make sense? Rather than trying and managing the insulin during it.
So if I'm understanding this correctly, for a match, you want the blood glucose levels being a little bit lower and for them to load with carbohydrates during the match?
No, so we want the starting bit the same, but what we wouldn't, so ideally what we try to say to them is exercise, try and start your team game 2 hours outside your meal. But don't reduce the background.
Yes.
So that you've got a reasonable amount of background, and then what we'll do is we'll give you the glucose to keep up your blood sugar.
Okay.
Because if their glucose rises, then they can just cut back on their glucose and they've still got some insulin that will bring it down. If it falls, then we just increase their glucose. And then it's a question of just working out whether that works, and we might need to decrease the background slightly.
So it comes back to that ICE acronym that you used at the beginning. You either adjust insulin, carbohydrates, or exercise.
Yeah.
And in this case, you're using carbohydrates as your primary tool.
Yeah.
Okay. So there's some really useful stuff there, and I think that anybody that's playing in team sports, I think that they would do well to watch the other videos that we've created on aerobic and even anaerobic exercises, and even the one on high intensity interval training, because I think I'm right in saying that there's a lot of crossover between mixed mode sports and aerobic, anaerobic, and even high intensity interval training, and that by watching those videos they can start to see how the model for diabetes and exercise in their own particular sport may be adapted. Would that be a fair assumption?
Yeah, I think that would be a fair assumption, and if they're getting to the higher level, then it's worth having a conversation with the coach, because almost all clubs now or team sports are moving to the fact that they'll have a dedicated aerobic session, a dedicated anaerobic session, and they'll have a dedicated HIIT session. And if you know when that's going to happen, then you can make plans as to and then work out the plans of how you're going to deal with each of those training sessions that can be slightly different.
Okay, excellent. And so we've spoken about managing blood glucose levels before a match. We've spoken about managing blood glucose levels during a match. Should we make any provision after a match?
So after the match, just to say one other thing you can do in the event, if you're not at an elite level, what you can do is just think about where you are on the pitch. So remember that if you're forward, you don't do much running. If you're in the middle of the park, you do lots of running, and if you're at the back, you don't do very much. If you're finding you're having a little blood sugar, then just see if you could do a positional change to help with that. So you can use the exercise again to help manage your blood sugar if you're finding that is an issue.
So it's just about thinking about exercise slightly differently from your peer group.
Yeah.
Yeah.
And then the other thing post exercise, you've done most team sports are 90 minutes. So remember that you've had credit for 90 minutes. So that's a long time for most of the exercise you do. So that means that your risk is quite high because you're going to have that credit back.
And this talks about the credit card analogy that you used in aerobic exercise videos, doesn't it?
Yeah.
So sorry to interrupt you. So you need to get that credit back.
Yeah.
So that's going to be taking on calories and carbohydrates and proteins.
Yeah. So carbohydrate and proteins. We say that if you're doing something that's that long, what you should be doing roughly is the meal afterwards. Is that you should be taking 1 gram per kilogram per hour that you did of the exercise.
Is that 1 gram of carbohydrate?
Yeah. And you should be taking 0.2 grams per kilogram for protein. There's no evidence that going above taking 20 grams of protein is of any benefit. So once you get to that ceiling, you don't need any more than the 20 grams. But that's what you should be having as a recovery afterwards. Most of the team sports with clubs have, particularly if you've gone to an away match, will give you food. I think the thing we always have to mind out for is the drink. And that's the thing with mixed events is there always is a social component to it, and drink and exercise are a no. They put you at much greater risk. So if you are going to have some alcohol, 1, remember it's not calories. 2, remember that you're really going to have to keep a close eye on your glucose, and you're going to have to be much more radical with reduction of the insulin overnight.
You read my mind. I was about to ask you about alcohol in a post-team event. I know for me on running, on a few occasions I've had a beer or two after a half marathon on very few occasions, and it's never ended well. My personal position is that I just won't do it, but in a team event it's a much more difficult thing to say no.
Yeah, and we have this odd thing in team events that if you play very, very well, then you end up having to have a yard of ale or something, which I'm not sure anybody enjoys.
Thank you, Dr. Andrews. You've shared a phenomenal amount of knowledge with us. For the audience out there, Dr. Andrews has shared with us a whole collection of videos on aerobic, anaerobic, interval training and mixed mode training. And I would advise you, if you are interested in diabetes and exercise in any way, shape or form, just go and take a look at the videos. Dr. Andrews has shared with us some incredible insights, and I've learned so much from you this morning, and I just want to thank you so much for your time and for sharing your knowledge. Thank you so much.